Your health and wellness are important. We had an article in July's newsletter that discusses how BMI and sleep apnea can affect you and your ability to drive. The company offers a lot of resources to you, and we will be discussing those resources as well as how the recommendations will affect you here in Colorado. First, let's talk about the concept of wellness and what the term wellness means. Wellness and good health have traditionally been viewed as freedom from disease. After all, if you are not sick, you are healthy, right? Today, wellness is viewed as an overall state of health and is closely related to your lifestyle. Wellness can be defined as an active process through which you become aware of and make choices toward a more successful existence. In terms of wellness, each person has a responsibility to provide such health essentials as good nutrition, proper weight control, exercise, controlling of risk factors such as smoking, alcohol, and drug use. Wellness research shows that Americans who take care of themselves and manage their lifestyles are healthier, more productive, have fewer absences from work, and make fewer demands for medical services. Since lifestyle has been found to be the single most important factor in determining your pattern of general health, it is important that you be educated to take charge of your daily life and to set healthier lifestyle goals. The choices you make have a dominant influence on your health and wellness. The secret is not only in medical care, but also in consistent self-care. Wellness encourages you to take personal responsibility for your well-being. There are some inherent health risks associated with being a driver. For instance, sitting for long hours. In fact, some have called sitting the new smoking. Researchers have linked sitting for long periods of time with a number of health concerns, including obesity and metabolic syndrome, which is a cluster of conditions that include increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. When you sit, the process that breaks down fat and sugars within the body stalls, and your health risks increase. When you're standing or actively moving, your body kicks those processes back into action. Whether actively moving means doing some simple stretches while driving, taking a quick walk during one of your breaks, or doing some push-ups and sit-ups in your hotel room, movement is your friend. So, you're probably wondering, what is this recommendation that I keep referring to? The FMCSA released recommendations at the end of 2013 regarding obstructive sleep apnea and BMI. More specifically, the FMCSA is now recommending that drivers who are attempting to obtain or renew their DOT medical card and who have a BMI of 35 or more and/or a neck circumference of 17 inches or more be tested for sleep apnea. This is tested through completing a sleep study. This is before they can receive their certification. When drivers are recertified, the recertification is only recommended for 90 days. There is one main reason why the FMCSA is making this recommendation. The FMCSA's goal is to reduce commercial vehicle-related fatalities and injuries. A FMCSA study found that an estimated 28% of CDL holders suffered from some form of sleep apnea, ranging from mild to severe. Sleep apnea is a common disorder in which you have one or more pauses in breathing or shallow breaths while you sleep. This state of not breathing can occur up to hundreds of times a night in some people. Obstructive sleep apnea is the most common type of sleep apnea and occurs when there are repeated episodes of complete or partial blockage of the upper airway during sleep. During an episode, the diaphragm and chest muscles work harder to open the obstructed airway and pull air into the lungs. According to the National Heart, Lung, and Blood Institute, more than 12 million people in the U.S. have sleep apnea. Of the total, more than half are overweight. Your chances of developing sleep apnea increase if you are related to someone with sleep apnea and as you increase in age. Other factors include having a large neck circumference, high blood pressure, diabetes, and smoking. As a result of sleep apnea, the quality of your sleep is poor, which increases the likelihood that you will be tired during the day. In fact, sleep apnea is the leading cause of daytime sleepiness. Sleep apnea not only causes drowsiness on the road, which increases the chance of having a work-related accident, but also impacts general health and well-being and has been linked to a variety of chronic diseases, such as diabetes, hypertension, and most notably, obesity. Additional symptoms include headaches in the morning, trouble concentrating, forgetfulness, depression or irritability, night sweats, restlessness during sleep, sudden awakenings with a sensation of gasping or choking, and difficulty getting up in the mornings. Sleep apnea is both treatable and preventable. Aviation and Occupational Medicine, Citadel's Denver-based DOT medical provider, has updated its requirements for issuing DOT physicals. Aviation is now required to report the results of all DOT medical physicals to the FMCSA. Additionally, aviation must now be mindful of the recommendation on obstructive sleep apnea and body mass index. Aviation's new requirements are: if you have a current diagnosis of sleep apnea, you must bring a report showing compliant use of your CPAP machine with you to the DOT exam. You will not be certified without this report. Drivers without a diagnosis of sleep apnea, but with a BMI of 35 to 39, will receive a maximum certification of 1 year and may be required to do a sleep study prior to recertification at 1 year, depending on other health considerations or factors. Drivers with a BMI of 40 to 44 will receive a maximum certification of 6 months and will be required to do a sleep study prior to recertification at 6 months. Drivers with a BMI of 45 or greater will receive a maximum certification of 90 days and will be required to do a sleep study prior to recertification at 90 days. Any driver, regardless of BMI, who has an accident or incident resulting from falling asleep while driving will be required to do a pulmonary function test and meet the expert panel minimums to be recertified. There is an additional charge for this test of $57. It is also important to note that any driver who is unable to complete their exam on the day of the exam, whether due to blood pressure, sugar, vision, lack of medical records, etc., will be deemed temporarily disqualified and reported accordingly to the FMCSA. Upon return at a later date, there will be a $45 DOT completion fee associated with the visit and updating of the record at FMCSA. No more than 14 days may pass between the initial exam and the completion exam. At day 15, a new DOT physical examination must be started and will be charged accordingly. Bottom line, your health is affecting your ability to drive for the company. Body mass index, or BMI, is a measure of body fat that is based on height and weight and applies to adult men and women. According to the CDC, BMI is a fairly reliable indicator of body fat for most people. BMI is used as a screening tool to identify possible weight problems for adults. The chart on the screen provides you with a breakdown of what a person's BMI means in terms of their weight status. The company cares about your health and well-being. You are our greatest asset. We encourage you to participate in the Fit for All wellness program. This comprehensive wellness program includes free biometric screenings and health risk assessments, which are done annually, free access to the company's gym, free access to group exercises 4 times a week, free access to the company's health and wellness trainer, free participation in wellness challenges, free access to in-house and recorded health-related seminars, free access to pre-recorded exercise routines that you can do anywhere. The company also has additional resources available to you, including access to stretches and/or exercises you can do to better your health. We encourage you to take advantage of all the free offerings available to you through the wellness program. Additionally, the company will be downloading the Stop and Go app onto your phone. This app has the menus for major fast food chains throughout the country and will tell you what menu items are healthy options based on color-coded groupings. Green means go, and these items are the healthier options. Yellow means proceed with caution, and red means stay away. If you have to stop to get fast food, please use this app to help you make healthier choices. Our monthly newsletter also provides you with not only great driving tips, but also great wellness tips. We encourage you to take advantage of other resources that may be available to you. Please visit your primary care physician annually for your age-appropriate screenings. Nationally, Americans use preventive services at about half of the recommended rate. Chronic diseases such as heart disease, cancer, and diabetes are responsible for 7 out of every 10 deaths among Americans each year and account for 75% of the nation's health spending. These chronic diseases can be largely preventable through close partnerships with your healthcare provider or can be detected through appropriate screenings. Detecting health issues early is the key to treatment success. Healthy eating, exercising regularly, avoiding tobacco, and receiving preventive services such as cancer screenings, preventive visits, and vaccinations are just a few examples of ways people can stay healthy. The right preventive care at every stage of life will help you stay healthy, avoid or delay the onset of disease, keep diseases you already have from becoming worse or debilitating, lead productive lives, and reduce costs. If you do not have insurance and need resources about how to access Colorado's state exchange, please contact the HR department. Additionally, you can receive services such as prevention and wellness treatment and monitoring and management from providers such as Walgreens Take Care clinics. However, it is recommended that you have a primary care physician for your preventive visits, as well as for treatment and management of any health concerns. There are some great online resources for driver wellness. One resource, called Driving Wellness, has information on topics such as getting enough sleep, your health and driving, and how to locate healthy options on the road. To find out what your BMI currently is, you can visit the National Heart, Lung, and Blood Institute's BMI calculator. For your convenience, a link to these websites will be emailed to you. Your health and wellness matters and impacts your job. New regulations are being imposed to limit accidents and ensure that you are healthy. The company's wellness program offers some good options and resources to help get you on a healthy track. There are also outside resources available to you. Get your preventive visits done annually. In upcoming newsletters, we will also be featuring more articles on health-related issues that will affect you and your ability to drive, so stay tuned.